and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And here I am today with Dr. Deborah O'Connor. Hi, Debbie. It's so nice to have you here today.
Yes, very nice to be here.
It's wonderful. You are, of course, a presenter at our Gold Neonatal Online Conference of 2025. And your topic is Nurturing the Gut, the Critical Role of Early Feeding Practices in Microbiome Development. That's absolutely fabulous. It's such a fascinating topic. I want to go into that in just a moment. I want to hear first a little bit about you. Where in the world are you? And tell me about your background, your professional background.
Right, so I'm located here at the University of Toronto and also working in most of the NICUs in the Greater Toronto area, 18 NICUs with our research. And I'm a PhD trained dietitian, and our research program has studied maternal infant nutrition in Toronto for about 25 years. Yeah.
Fascinating, wonderful. Yeah, and you became fascinated with the microbiome, right? So tell me a little bit, how did it happen that you specialized in the NICU with the little ones and the microbiome work and research you're doing?
Yeah, right. So, yeah, we've been studying like early nutrition of preterm infants is still a very understudied area. It's a hard research topic to study, and it really requires a lot of collaboration. And in Toronto, we have this somewhat freak of geography where about a third of the country's population lives in the Greater Toronto area. So we're able to do these studies of early feeding because we have the numbers of babies, and as babies get transferred closer to home, we can still follow them. And so we've been doing a lot of research over the years and looking at mother's own milk, the benefits of mother's milk, a big interest in neurodevelopment, and just trying to make babies grow as close as we can to in utero. And a lot of the things we were seeing had to do with the gut, whether things went well, whether things didn't go well. And so we took the leap and said, if we really want to know what's going on, we're going to have to jump in and work with some experts in the field on the microbiome. And what we started to find out was really fascinating. And once we were in that, looking at the microbiome, it gave us a lot of opportunities to kind of look at things differently. So that's how we got into the microbiome. We started with trying to answer a question, and that's where we landed.
Yeah, and you mentioned understudied. I'm sure there's still a lot of work to be done in that field, right?
A lot, really a lot.
It's, I'm sure you feel like you're just scratching the surface, and there's so much more to do. I find the microbiome so fascinating, especially what we've learned in recent years, how important, like, for example, from the gut, is like a vaginal birth, for example, right? Like how much does it have an influence on the microbiome on the baby? And, and how like the microbiome, like if somebody else touches the baby, what kind of impact that even has. So tell me a little bit about the microbiome for these little ones, these early, like these preterm infants, which I can imagine is quite different from the preterm baby that's born, correct?
Right. Yeah, very different. And you're quite right. Like, so the baby's gut is maybe not absolutely sterile at birth, but certainly it's not colonized. And so a baby that's in the NICU, if strategies are not undertaken, it colonizes what's in the environment. And that's not always a good thing.
Right.
And then there's lots of other challenges, right? There's separation from parents and the baby. There's antibiotic use. The babies are fed by tubes for the first little while. And then there's antibiotics, right? Prophylactic antibiotics. And then if a baby's sick, there's more antibiotics, and then the mother might be giving antibiotics too if she's sick. So it is a very different microbiome than in the healthy term infant, for sure.
Mm. And I can imagine it being quite tricky. We know nowadays how important human milk, is
Mm,
for the baby,
right.
especially with preventing, neck and
Hmm.
other diseases. But of course, if the baby is born so early, there will be medically necessary supplementation. And what
Right.
you mentioned with the feeding tubes and such. Um, I can only imagine there must be such a balance to figure out what is the right, what can we do with the microbiome
Hmm.
that it is as close as possible to
Right.
how it should be,
Right.
and without, causing disaster with all that. But of course, all these medical interventions are of course necessary too. So
Right.
talk to me a little bit about that.
Yeah, I mean, it like it's very complex. I've been doing studies in this area for, I guess, 30 years or so, and a very big signal on how the baby does in hospital is how much mother's own milk the baby
Hmm.
gets. So that's all very important. And we also know we have wonderful lactation support. I mean, we could always use more, but we do have really a
That's good.
wonderful lactation support. Almost every mother tries to express breast milk, but we know, and the babies we work with are those real little babies, the very preterm or extremely preterm babies. We know about 70% of them, the mothers, despite the very best attempts, will not be able to provide a complete volume at some
Mm.
stage, whether that's early for a couple days, whether that she has twins and not able to keep up, and so on and so forth. So, I mean, so kind of the microbiome strategy in our mind is when, we want to give mother's own milk. Do you give it fresh? Do you give it frozen? How soon can you get the baby to the breast so that you have fresh breast milk? We know that that skin to skin care
Hmm.
influences their microbiome. We give donor milk as the supplement. That is our standard of care here, but that's pasteurized. So we know we
Right.
kill the microbiome, but it still has those wonderful oligosaccharides in there that might help. And then there's also an area we don't work on a whole lot, but we consider it in our research, what's going on with probiotic use as well as antibiotic use. So it's very complex. And how do you untangle things? So
Yeah.
we've taken our group is best known for our clinical trials. So we try to look at feeding intervention using blinded studies, so that
Hmm.
we take out a lot of the variables by randomizing babies and doing these studies blinded, and to kind of get at what interventions might actually improve the outcomes using early infant feeding strategies. So
Mm. Yeah.
complicated. And at the same time, we do a lot we know that feeding tolerance very much influences how much mother's milk gets into these babies. And, we keep talking about the microbiome and all these other things, but in my presentation, I'll really talk to you we can talk about all these other things, but it really is the volumes of mother's own milk that makes the difference in
Mm.
terms of having the best microbiome composition for these babies.
Absolutely fascinating. When you talked about your research there, I'm just curious, is there something that surprised you or was exciting that stood out to you
Uh,
in your time?
oh, there's, I mean, two recent things, and maybe I was the only one who was surprised, but I think everybody really appreciates antibiotic stewardship in the NICUs. I mean, that's really been talked about a lot in the last 20 years. You see there's a lot less antibiotics being used. People are very thoughtful about it. And that all really made sense. But in our research, when we were looking at the mother's milk, the microbiome in mother's milk, we have to also consider the antibiotic use of the mothers. And
Mm. Yeah.
that really slapped us across the cheeks on either side, to know how much that influenced mother's antibiotic influences her milk microbiome, and then therefore what is used to colonize the baby's gut. So that surprised me. More recently still, was, these babies are tube fed, and I guess and there's all skin to skin care. All our units do really encourage mothers to do skin to skin care, and we have a huge uptake on that. But just to see the difference in the gut microbiome once the baby is put to the breast is crazy.
It's amazing. That is
So,
amazing.
and then we know that diversity of the microbiome is one of the best predictors of a healthy microbiome. So, getting that baby to the breast is really very important. And it resulted in a lot of conversations in our group about, is there any way that these very preterm babies could be put to the breast much earlier than they are presently.
Yeah. Wonderful. Thank you so much for sharing. This is certainly some great news and information there. Now, before I let you go, what are you hoping that the viewers will take away from this presentation?
Well, I hope they take away from this presentation that for people that don't know anything about the microbiome, just to understand how important mother's milk is at delivering its own probiotic and prebiotic, whether that's a term baby or preterm baby. And the other thing I hope they get away from it is, despite all that's going on with preterm babies, a lot of this colonization still occurs. Despite all of the other things going on, it still occurs. And so, and the microbiome we know is related to those acute outcomes like necrotizing enterocolitis and sepsis, but longer term outcomes like allergy, asthma, etc. So I think it's kind of an exciting story, really. And so I just I think that it's just really amazing that we have this sort of functional food right there for everybody to use. A lot of work to do it for our families. But anyway, that's what I hope you take away, just all the really strong evidence of benefit.
Wonderful. And I can hear your passion in your voice when you talk about this topic. You were really, really invested and really did a lot of wonderful work in this field. Thank you so much, Dr. Deborah O'Connor, for being here with me today. And I'm looking very much forward to your presentation here with us at Gold.
Excellent.
And now some information for our viewers. The presentation, Nurturing the Gut, the Critical Role of Early Feeding Practices in the Microbiome Development, is part of our Gold Neonatal online conference. We get started just in a little bit. It's just around the corner. On June 3rd, we have our open access and free to everyone keynote presentation. So make sure you check that out. And you can find more information about this presentation and the other great presentations in the conference. You go to goldneonatal.com. I hope to see everyone at the conference. Thank you all for watching. Bye-bye, everyone.